Question 2.2 is looking at how a stem cell transplantation is a long-term treatment for people with SCD, the sickle cell disorder. So the patient will receive stem cells from the bone marrow of a person who does not have the sickle cell disease. The donor is often the patient's brother or sister, and before the treatment starts, the patient's faulty bone marrow cells have to be destroyed. And they want us to use the information to explain how the HSCT is an effective long-term treatment. So it's wanting us to explain that if they get this treatment, then the blood cells that they produce are going to be healthy red blood cells, or it's going to produce the normal polypeptide or normal hemoglobin, or the idea of produce only healthy red blood cells is also acceptable, or the idea of normal or non-SCD cells. For the second marking point, it's then to do with saying, as well as producing those healthy cells, they are not going to be producing any of the sickle-celled or the faulty cells or the SCD red blood cells, or no defective polypeptide or hemoglobin. And then the third marking point is the idea that because they've used stem cells, then the stem cells from the bone marrow, then they would continuously divide and replicate in order to make these healthy red blood cells. Or we could also link in the fact that, as it tells us in the question, that the donor is often the patient's brother or sister, then there is a lot less chance of rejection from happening. Differentiation is not equivalent to divide or replicate.